helping you lead a healthier life. This is CURES.
Hi everyone, it's time now for CURES. Thank you for being here, where we explore the cutting edge of wellness. I'm Kara Sundlin. So the question we're taking a deep dive today to answer is, could ketamine therapy really change the world of treating mental health disorders like depression? Joining us now is an expert in this, Dr. William Prueitt from the premier Silver Hill Hospital in New Canaan. It's one of the only hospital-based ketamine clinics in the Northeast. Doctor, thank you for being with us.
Yeah, thank you for having me. It's great to be here.
This is something that people might be seeing in magazines or hearing about, but I just want to start with the very basics because I think a lot of people still don't know. Like, what is ketamine?
Yeah, it's a great place to start. There are a lot of stories out there, and I think starting here is important. Ketamine is actually a very old medication, first approved by the FDA in 1970 as an anesthetic agent. It's been used a lot over the years for that purpose, still used across the country for that purpose today. But starting a little over 20 years ago, it was shown to have a really strong effect for depression as well. So in the last 20 plus years, researchers across the country have been studying ketamine to treat depression, and there's been growing evidence that it's actually very effective for patients with depression that haven't responded to other medications.
If I'm correct, it's used in anesthesia, and then somewhere along the line, people actually realized it was really helping people with their moods.
Exactly, yes. I was using anesthesia, and sort of the story I've heard, and I don't know how much is lore and how much is truth, but some researchers at Yale, the current department chairman, actually John Crystal, they were using ketamine as a model for studying psychosis, actually, and sort of serendipitously found that patients they were treating were becoming much less depressed when they would call and do the follow-up interviews. So they got this sort of signal that maybe it was actually helping a lot with the depression. And then from there, further studies were designed to ask and answer that question.
So let's talk about how you're using it, because you're one of the first hospital-based places to use this. Talk about who would benefit from this and what happens when they go to Silver Hill to use ketamine.
The main patients that we look for that we think can benefit most are patients with what we call treatment-resistant depression. Most of the studies for ketamine have been done with this population, patients with depression. And treatment resistance, it's defined in the field as having 2 adequate antidepressant trials, sufficient duration, sufficient dose, and they just didn't work to alleviate the depressive symptoms the person is feeling. So they have to at least have that. Many patients have had many more. And so if they have depression of this sort, then they would be a potential candidate. And those are the type of people that we're evaluating for treatment with ketamine.
From what I understand, you're seeing breakthroughs where people who have not been able to get relief, maybe even they were suicidal, and they're reporting after even a couple of sessions, a complete lifting, a feeling that they haven't experienced.
Yeah, definitely. Ketamine also is actually very effective for suicidal thinking, to sort of alleviate that very rapidly. And I don't want to give the impression that ketamine is a miracle cure and everyone should have it and it's going to fix all the challenges people face. But we have had some patients who have really done amazing, and patients who will fall into a depression, and every time this happens, the depression will last for, thinking of one patient in particular, the depression would last for a year. And she tried ketamine with us. It was her first time having the treatment, and just after a few treatments, you could see her mood lifting, the depression going away. And within just a handful of weeks, the depression has sort of lifted. And she stayed with us since then, and it's sort of continued to stay away.
Is it safe?
It can be very safe with appropriate psychiatric screening, appropriate medical screening, appropriate medical and psychiatric supervision during the infusions. Yes, it can be very, very safe.
And talk about what happens at Silver Hill in New Canaan. I know we've got some pictures, and maybe our director could show us for those who are viewing this and not listening on the podcast, but you're seeing a beautiful bucolic setting in New Canaan, Connecticut, on the Gold Coast of Connecticut. I mean, just a beautiful setting, very relaxing, very therapeutic. People often go there for different therapies. But what happens when they come to have a ketamine protocol at your facility?
Yeah, I'm glad you mentioned the setting. I think the setting is important, and we're lucky to have a really beautiful place here to do the treatments. And I think this goes into sort of the broader field of psychedelic medicine in general, that this idea of setting actually can be very important to the treatments, the patient's experience, the outcomes as well. So what goes into the treatment? Was that the question?
Yeah. What was, so you check in? Are you there for a period of time? How does it work?
So just very briefly, there's just an evaluation and screening process that happens first. So the person could call our admissions department, get some more information about the treatment, talk to one of our admissions coordinators. We then eventually do a psychiatric screening to make sure they're appropriate psychiatrically. Later, there'd be a medical screening by a medical primary care doctor, another medical professional, to make sure medically it would be a safe treatment. There's preparation for the sessions before, what to expect, how to navigate, both good and difficult potential experiences. And then assuming all of this goes well and then looks appropriate, then the person would come to Silver Hill, to the ketamine clinic. We have a really nice, very beautiful space with lots of natural light and comfortable treatment rooms dedicated to this. They would check in. I would speak with them that day, see how things are going, talk to them about their previous treatments, if they've had some, talk to them about their treatment that's upcoming, what they want to have on their mind. And then we would have them come back to the treatment room, which you can see pictured here.
Yeah, there you are.
An IV would be started. And we also have specially trained nurses here that help with this process as well, who are very good at helping the patients should anything come up, should anything be needed during the treatments. And then after all this is set up, the patient would have a blindfold, noise canceling headphones, playlists to listen to. We sort of encourage an internally directed journey during the experience. So they would sort of relax in one of these infusion chairs and really spend the time on an internal journey. The music can support that. And then the infusion starts. The infusion itself is 40 minutes. And then once the infusion is over, we have patients stay for about another hour to come back to their baseline mental status, to discuss the treatment with them and how it went, to debrief what went well, what information came up, if there were interesting experiences. And then after that hour after the infusion, the vast majority of people are basically back to their normal self. They might feel a little more tired, but feel about normal, and then they would go back to their day.
Okay.
They can't drive, operate heavy machinery for the rest of the day, but they can then just return to their normal life. Some sort of exceptions.
So when we hear psychedelic, you immediately think of a high, a trip, some sort of a out-of-body experience. Is that what it's like when you are on ketamine, or what happens when you go through the treatment?
It's a good question. A lot of people wonder about this. It can be highly variable from patient to patient, from one patient, from one session to the next. It can really differ. And it can be hard to predict exactly what it is that's going to happen. I will say for the vast majority of patients that we've treated here, the experience is quite nice, pleasurable, and enjoyable experience to have. A lot of people come in very anxious about if it's going to be like a difficult thing to experience. But the vast majority of people actually have a very nice experience. And it's a minority that have a difficult time. So saying the experience itself, it can be hard to predict what it's going to be. People can pretty reliably expect sort of a change in their sensory perception of things. Lights, sights might seem a little different. Sounds maybe are more intense or a little different. Their body might feel different. They might feel a bit disconnected from their body, sort of floaty, or might feel sort of like they're moving slowly, their perception of time can change. And then oftentimes visually, they can experience different things from bright colors to sort of what is often described as like a dreamscape, where similar things that might happen in a dream kind of happen there, where people in your life might be involved in some scene. You might be talking to them or seeing them do something. People will see their kids grow up, or an important conversation with a loved one, or difficult things from their past can come up as well, and they can experience that in the infusion. And sometimes people will just sort of reflect and relate to their own mind and wonder why they take certain things so seriously, or why they have such a difficult time letting go of certain thoughts that might come up. So it's really, and there are other things as well. It's a broad array of different experiences that a person can have.
Yeah, and this is something that if you do a quick Google search, which I have done in preparation for this interview, I've certainly seen how you guys are doing it, but I've also, if you just put in ketamine therapy, you're gonna immediately find a lot of companies that are saying, out of office, just sign up here, send it to you, different things, and different states are starting to find ways to legalize ketamine for certain things, or the FDA is on a way to a pathway to getting this approved. So I guess it appeared that there was easy access if I wasn't going to go to Silver Hill, and you could just try ketamine. And the difference, I want you to talk about the difference of what we're doing in a hospital setting with a psychiatrist who has an expertise in ketamine like yourself, versus maybe some of these things that people are seeing out there in the wild west of psychedelics.
Yeah, this is another great question, and I think a controversial and a much debated part of the field right now. In my opinion, I think there are various parts of this process that need to be done well to ensure safety for the patient and best outcomes for the patient. One is really good psychiatric screening to see if they have the appropriate conditions that would benefit the most from ketamine treatment, and that they do not have conditions that might be worsened by ketamine treatment. Appropriate medical screening initially is also important to make sure there are no medical risks. And then all along the way, I think really good psychological support, interactions with the treatment team, to ensure that the experience itself is a positive one, a supported one, and then also that the infusions themselves are monitored by medical professionals, so that should anything go wrong, there are people there who know what to do, and also just if they need help, there are people around who can assist them. I think sometimes when things go wrong with the ketamine treatments, it can be when there's no one around to support the patient, to help them when they're in this sort of altered state.
Right, so as a patient, it's not like doing regular therapy where you're just in your normal conscious state talking to your therapist or deciding what medication to take. You're really in an altered state when you're taking ketamine, and you're gonna help determine the right dose, and whatever happens, whether it be an enlightening experience, or if, I don't know, if paranoia or something like that ever happens, you're gonna be there to guide people through it.
Right, exactly. And we want them to feel safe and secure and able to sort of let go and experience whatever is going to happen, and not have to worry about whatever is happening in the environment around them. We want them to be in a safe, secure place where they can just be with their psychological experience and not need to navigate the world, make other decisions about what they're doing, or have this anxiety in the back of their mind. If anything does go wrong, who's going to help? Knowing that there are people there, I think is very beneficial for both their physical and mental safety.
Yeah, I mean, let me just ask you this, because people must be wondering, like, what could go wrong? What would be an experience where you would say, okay, something went a little wrong here, and I'm glad I was with someone like the doctor?
It can range a lot. I mean, for one, ketamine, as we talked about earlier, is an anesthetic agent. So if someone takes it, they can become sort of anesthetized and not lose hand-eye coordination, not be able to move very well. If they're in any sort of dangerous situation where they could fall or be exposed to water or anything like that, they could get themselves into a dangerous situation physically because they don't have the same control over their body that they might normally. So, I mean, those are some of the physical health. Also, if people take an extremely high dose, higher than they were intended to take, there can be sometimes difficult physical reactions that come from that. And then psychologically, if people take this dose and end up in a difficult place, and an experience they haven't had before, that is frightening, anxiety provoking, whatever it is, it's very important to have a trained mental health professional therapist there who can talk to them about it, to help them through it. In our case, to pause the infusion, for example, to stop the medication going into their body to help them to calm down, or to, if needed, and this doesn't happen much in our space, but to give a medication that can help calm them and bring them out of that experience.
So Silver Hill now joins just a select number of hospitals that has this comprehensive mental health services that's administering ketamine treatment. We saw the beautiful setting. They're in this reclining chair or a bed, a doctor around, all of this. Do you see this becoming more the future of medicine, where it's going to be more widespread based on some of the clinical studies that are showing just major breakthroughs with ketamine?
I think it will become more widespread. I don't think it's going to be the only type of treatment around. I think there is this new and emerging part of psychiatry, what's called sort of psychedelic medicine right now, but this new wave of treatments that are sort of approaching treatment in a different way. And the medications themselves are often working in different ways in the brain. Like ketamine, for example, works very differently than any of the antidepressants we really had before. And also they induce these sort of interesting, potentially very useful states of consciousness and experience that can then be explored and processed in psychotherapy to provide new insight, or to speed up that process, or to promote cognitive flexibility or neuroplasticity, this changing of the brain in the ways hopefully you'll want, and that can be supported through therapy. So I do think this area of mental health treatment is going to continue to grow. Ketamine will be sort of a part of it. I think it won't be the only substance medication that's being used, but I think it will be an important part of it, and potentially someday there'll be sort of an array of different choices depending on the patient and the diagnosis and different things like this. So there'll be different options that they can choose.
I mean, the term psychedelics brings up a whole bunch of imagery for people. They can think back in the 60s. They can think of the experiments with Timothy O'Leary, who was a Harvard scientist who thought there was great benefits to psychedelics, but ultimately at that time he ended up losing his job. And we remember these, experiments. We hear about Native American cultures using plant medicines that give you these options, and there's more and more retreats. I mean, it's been on Oprah, it's been on magazines. More people are exploring these ideas of psychedelic medicine or psychedelic retreats, like maybe they're going to go away for a few days and do a magic mushroom journey. How is this different, ketamine versus some of those other psychedelics?
So, for one, the other psychedelics, and probably two of the major ones right now that are being studied and showing some promising results, MDMA and psilocybin being the active ingredient in magic mushrooms. Those two are not yet FDA approved, still being researched. So they're not really freely prescribable by doctors right now for treatment. That's one big difference at the moment. MDMA recently has been fast-tracked, and the FDA is, I think, reviewing the data they have so far and looking to make a ruling sometime this year, from what I know, as to whether or not it should be approved for treatment. So some of these things are coming, but because of that, it's not as, I think from what I know, the treatment centers are not currently offering that. There's not as much oversight in treatments.
And they tend to be in other countries, it seems like you might be going to some of the famous ones, ayahuasca, I think it's in Costa Rica. And I did a recent podcast with the Journeyman Collective, beautiful place, that's in British Columbia. So perhaps you're going to see more of that as these retreat travels and tend to be more for personal development, not necessarily for major depressive disorder.
Yes, exactly. And that's a whole other part of the field and debate we probably don't need to get into right now, but there is this idea of how much should be reserved for mental health treatment and how much should be for personal exploration, or what sometimes is called the betterment of well people. And you're right, most of this is taking place outside of the US, primarily because it's not legal here right now.
Okay.
But these substances, they do work in different ways in your brain. Neurochemically, and the neural receptors they're hitting are different, and the experience itself can be different as well for patients.
Let's talk about how it works in the brain. From what I read, it works on the serotonin and dopamine receptors. So how does ketamine actually help people feel so much better?
So ketamine it's hitting a lot of different receptors, but one of the main sort of proposed mechanisms of action, one of the strongest effects it has is an NMDA receptor antagonist. This is working on this system of neurotransmitters in your brain called glutamate. That's actually the main neurotransmitter, main excitatory neurotransmitter in your brain. So it's different than serotonin and dopamine and norepinephrine, which are the main neurotransmitters that have been targeted by most of the antidepressants we've used up until now. So it blocks this NMDA receptor, and by doing that, it leads to an increase in glutamate release in your brain. We're not exactly sure what all the downstream effects are, but one of the things that the research scientists have noticed is that this increases neurotrophic factors in your brain that help neuroplasticity. So that's one line of thinking, is that this process can help people to sort of rewire their brain in a way, form new connections, change ways of thinking, get out of different sort of ruts of thought that they might have.
Okay, all right, that makes sense. I think some people who are interested in mental health probably have some idea of neuroplasticity, that our brain is much more like Play-Doh than fixed. So the idea that when you're doing this treatment, it's allowing your brain to kind of make these new pathways. And then people are reporting that they don't know why, but for the first time, it's like the lights are going on.
Mm-hmm. Yeah, right. It can sort of like unlock things that, maybe are there, but need a little help being connected or coming to the fore. And, it doesn't change people from who they are, but it can sort of help them to be more the version of themselves that they want to be. Like one of the patients we've had, where she's her friends and family have told her after the treatments that they haven't seen her doing this well or being so much herself in 10 years. It's really helping her to enact the change in her life that she wants.
I mean, if people are wondering how many people, it's actually a big number. The Kaiser Foundation says 32% of adults in Connecticut report having depression. Right now, specifically, you're using ketamine therapy for people suffering from a major depressive disorder that's that's resistant to other forms of treatment, where nothing else has worked. But when that's happening, it could be a real lifeline to these people. These are people who feel like maybe they don't want to go on sometimes, and that there's no hope for them.
Yeah, it definitely can be. There's a huge percentage of the population that struggles with depression, and many of the other treatments that we have can be very effective for some people, and also don't work for a lot of the people who have depression. And ketamine is one of our really sort of new and leading treatments that's been shown to be really effective here in this world. And the people I've treated, many have said, sort of it's the thing that's saved their relationships or kept them out of the hospital or kept them alive.
Yeah.
Many people credit it for helping them to either improve the quality of their life or just to stay alive. So, I mean, it doesn't work for everybody. I don't want to make it seem like this is going to be the treatment for every single person, but for appropriate patients, it can be really, really effective and life-changing.
Yeah. I noticed in at least what I was sent to read, it's for patients 18 and up. And I don't know if that's just because what you're doing right now, but there are so many families struggling with teens who are facing real depression, even suicidal thoughts. Does this have application for teenagers, or we just made the cutoff of 18, or could it someday be used for teenagers? What's the thinking behind the 18 and up?
So the reason we chose that cutoff is the vast majority of the studies on ketamine have been done in the adult population. And we really wanted to base the work we're doing on, as close we can to the research that has been done to show that it's safe and effective. That's not to say that it couldn't be safe and effective in younger people. When I was at Yale, there were some people we would treat who were younger. So I think there's more to explore in that area. And it's not that it's necessarily off the table for all of them, but we have chosen to treat patients who are 18 and older.
Well, we're coming to the close of our time, but I want to put up, if we can, the information of where you all are. I know you said the first thing to do, if someone is hearing this and thinking either yourself or a loved one could really benefit from this, you can reach out, the silverhillhospital.org, right on New Canaan, 208 Valley Road. And you say the first step really is to call, and they can begin to let you know. You've got 21 full-time board-certified psychiatrists, and you do admit many, many people that suffer from many different mental health challenges. But the first step would be to make a phone call to see if this is the right treatment for you. And of course, cost, I'm sure, is going to be a factor, because at least at the moment, many insurances are not going to cover this.
Right. Unfortunately, insurances have not been covering it very much. But if people are interested, I would suggest they, look Silver Hill up online. They can call our admissions department, talk with our staff here, speak with their own psychiatrist about it, to get their sort of trusted person's ideas about the treatment. At Silver Hill, we're currently treating inpatients, residential patients here on campus, and outpatients coming from the community. So really, you wouldn't have to be here on campus to get the treatment. It's perfectly safe for outpatients, to come and get the treatment and then to return home to their normal life.
Yeah, so basically, if you are in Connecticut and this is something you want to explore, you could just go in for that 40-minute treatment plus the observatory period, and then go back to among your day. And would you do this once a week? We're running out of time. If you can answer that quick question, we only have 30 seconds left. Is it about once a week, or?
I'll answer it quickly. It's twice a week for 4 weeks. If it's going well, once a week for the next 4 weeks, and then we sort of space it out from there.
Okay, well, fascinating subject. I know it's just a new frontier in the mental health world. So, Dr. Prueitt, thank you for sharing your expertise. And I hope that this message can certainly make its way and help a lot of folks out there if they're the right people. Thank you for being with us.
Great. Thank you so much for having me. It's been great.
Yeah. So you can follow me on social media at Kara Sundlin. I love to post this content there. And again, find this on WFSB.com as well, or listen on your favorite podcast platform. Have a great day, everyone, and be well.